Hello, everyone, and welcome. We're so glad you could join us for today's session in our Striving and Surviving webinar series. I'm AFDO Communications Director Jason Brill, and this series was created with you in mind. Regulatory professionals navigating budget cuts, uncertainty, and all the challenges that come with it. Many of us are being asked to do more with less, stretch resources further than ever, and adapt to constant change and uncertainty. That's why we launched this series, to give you practical strategies, expert insights, real solutions, and the knowledge that you're not alone. Throughout this series, we'll tackle key challenges like managing your department effectively with reduced budget, finding process improvements to boost efficiency, building resilience when everything feels unpredictable, and leading your team through times of change. Today's session, Best Practices for Handling Budget Cuts to Food Safety Programs, will offer guidance designed to help you prepare for the loss of grant funds, including determining strategies, evaluating resources, and determining how those resources are allocated to help avoid staff layoffs. Today, you'll be hearing from Pat Kennelly, Program Director at AFDO, Katherine Simon from the Minnesota Department of Agriculture and Feed Safety, and Steve Moris, Assistant Program Director at AFDO. We are recording this session and we'll make the slides available, so keep an eye out for an email in the next few days. Just a reminder, we also have a session tomorrow on leading through change and 2 sessions next week. Holding Steady, How to Lean into Resilience is March 12th at noon Eastern. And Doing More with Less, How to Streamline Your Operation When Funding is Cut is March 13th at noon Eastern. And you can register for all 3 of those by clicking on the links we just shared in the chat. Also, now's a great time to encourage everyone to consider an AFDO membership. AFDO can't do the work we do, such as these webinars, without the continued support of our members. An AFDO membership provides access to resources, training, and opportunities to engage with peers working on similar issues. It also offers you the chance to be part of a network where everyone learns from each other and contributes to meaningful progress. You can find more info by clicking on the link that we just shared in the chat. I know that's a lot of links in the chat, so take some time and dive into those while you're listening to today's presentation. And that's enough from me, so let's dive in. We'll kick things over to Pat and Katherine and Steve.
All right, thank you, Jason, and welcome everybody. Thank you for taking time out of your busy schedules to join us today. We're going to talk a little bit about government budgeting, and budgets are challenging. We know that, but when we get into difficult times, whether it's we have a lack of funding at our state level, or we're losing funding from some of our cooperative agreements and grants or contracts, we have to turn around and make some very quick choices. Sometimes the timing's not the best. But we have to work with it and do the best we can to make the best decisions we can in those difficult times. The cuts that we're seeing in FDA cooperative agreements is really unprecedented, and we know it's going to have a very significant impact on states. We've assembled the content of this webinar in the hope that it's going to help you prepare for these reductions, to help you ask the right questions, think about different strategies that you might be able to deploy, evaluate your resources, and determine how those resources are allocated so that you can make the best decisions possible to deal with that funding shortfall that you may have. With that, I'm going to go ahead and turn it over to Katherine, and we're going to go ahead and jump right into the presentation.
All right, thank you. And thanks to AFDO for asking me to share, and thank you to the audience for listening. And so just want to get us started here with an acknowledgement that this is a difficult situation. So in terms of the first place to start, really acknowledge that the changes are not happening in a vacuum. So there may have been specific FDA funding cuts related to grants that are before us now, but it is happening in the midst of other state and local program funding reductions that may come from other pressures to add additional work obligations or reductions to the funding through license fee accounts or other funding sources. So just to acknowledge that it is complex and there's probably going to be a number of different things moving around. So with that, we also want to acknowledge that we're under an umbrella of a social environment that is far more adversarial and challenging for regulatory service staff, and to just know that that's going to impact a lot of the emotions, a lot of the responses and stress that's impacting the staff as well as the managers who are forced to make these decisions. And understanding the emotion is that first step. It's when we can move from an intentional, from moving in that reactionary space to move intentionally into being able to respond in a thoughtful way and really make informed decisions as to what steps we need to take. So with that, you need to make sure you are taking the time to ensure you understand all of the potential options that you have to consider, and do that in a way that is exploring the investments that you've already made in relationships. Next slide, please. So the first step to explore a relationship really is within your own administration and leadership team. So you want to make sure that you're understanding and having an open discussion about what the impacts really are going to be. These can often be uncomfortable discussions to have, but they also need to be realistic. Coming from public health programs, we have a lot of times a can-do attitude, right? Our first response is always, how can we make this work? How can we make this work? Now is really the time to stop and say, what are the things that we are not going to be able to do? And get specific with it. Working through the choices that you're going to have to make. What are the real decisions in terms of stopping activities that are occurring? Within my own program, I really like to say that the prioritization is the identification of what you're not going to do. So in terms of budgetary prioritization, getting even more specific is going to be needed. So being very direct and open in your teams in terms of what those choices look like, despite the fact that they're difficult, the more open you can be and the more direct you can be, the better. You also want to be able to make sure that you relate that to the quality of the work for not only the short term, but the long term of your program. So there's specific grant deliverables that may be impacted, but really start thinking about how are those grant deliverables supporting you and the quality of your program over time. What's going to happen this year, but more importantly, how does this prevent you or support you in your decision making from getting where you want to be today to where the program needs to be in order to have good public health outcomes, and be prepared to be adaptive and responsive in the future as well. So start by looking at those things that are directly impacted in terms of your FDA contract, potentially in terms of the standardization activities that you complete, or in terms of response actions that you have the capability to respond to, but also think about how that's going to impact your program in the long run, in terms of how that impacts your services to your constituency. But you also want to discuss if there's other options within your agency in order to make strategic and tactical choices for how it is that you can maintain your competency and have more adaptability internally. An example of this may be, are there other programs within your agency, so not directly within your food program, but that are related in terms of their competencies or their skill sets or their needs that you can leverage out to fill these short-term salary and benefit issues that you have in front of you. So this could be an example of, can you work share a staff member who was previously dedicated to your program, but now their skill or service would be of advantage to another program based on where they're at in their development phase or in the services that those other programs provide. So this is really an opportunity for you to pull back and use your entire leadership team at your agency to figure out how you can move forward with that. Next slide. Additionally, in terms of the relationships that we need to explore, think of the investments that you've been making for the last years or decades. So leaning out into your industry stakeholders and your consumer groups to figure out what is the services that they value most, and finding ways that you can collaborate with them in terms of those services, being frank in terms of what may be changing in the future, also so that they can consider being a voice for you. A lot of times, the best voice in order to make your case is going to be somebody else who's advocating for you. So if it's something in terms of your state legislature, if you have an opportunity to do that, or if it's an opportunity with a congressional delegation, being able to be clear on what the impacts are in a way that is appropriate for you and how it is that you are expected as a leader in your program to manage and discuss externally, but making sure that you're being clear about what these impacts are going to be. Again, looking at programs overall, looking at the quality of the services, and making sure that they have the understanding that they need so that they can go forward and be a good advocate for you. So again, the greater specificity you can provide to this, the better off you're going to be. But also, again, view this not just as the voice, but considering how you can collaborate and potentially figure out a way that services can be modified or improved for the future as well, based on what those stakeholders specifically articulated needs are as well. With that, I'll go ahead and pass it off to Steve.
All right, thank you very much, Catherine. Now, I guess we can change your slide. Next slide. Thank you. Let's talk about understanding your options. What is your program expected to accomplish? What are your statutory what are your statutory requirements? what are your priorities? Are like you still going to just like to be able to actually respond to emergencies and to foodborne illness outbreaks along with your normal everyday today inspection and the actual outreach you are currently doing or meeting with the other stakeholders inside of your agency or like outside of your agency. Like you want to look at your actual unfunded mandates, anything inside of your agency that you are not paid to do. You want to look at those as possible cutting them, like if possible. Like you also want to look at the process for just for asking for additional funds. Is that going through the state general funds or like asking for a fee increase? And like as like Katherine mentioned, can like you shift or split staff between funds? And like what are the possibilities of funding staff from grants and contracts or like other grants and contracts inside of your agency? Next slide, please. And like when dealing with budget cuts, previous justifications and proposals may be a resource. Like you can use some of these materials to help highlight the importance of this work and like also determine what can or needs to be cut due to these funding cuts we are facing now. Next slide. Talk with your team and be upfront and honest. The actual reality is that like we can only complete work that we have funding and staff to actually complete. Less staff means less work. Like look at your program as a whole and look for opportunities to streamline, to free up funding, and like also challenge your managers to actually be creative. What are your wants versus your needs? Pat, I'm going to turn it over to you.
Thanks, Steve. And we can go ahead and move on to the next slide, Amy. So let's talk about some potential considerations. A couple have been mentioned so far, but these are things that you may be able to do to free up some funding to hopefully fill that gap, right? Everyone's taken a pretty significant reduction to their cooperative agreement. We've heard from a lot of states that they no longer have enough funding to fully cover a position authority and benefits. So some of these ideas may help you free up enough money to use some of your other existing funds to help cover that, at least as a gap year while you work to do something else to deal with this on a more long-term basis. Oftentimes our state budget process, we need a year in advance before we can get changes in our budget, right? We're submitting things in September that are going to go into the budget next July. And, we've oftentimes lost that activity. Here we are in March, and, most state budgets may start July 1st. You don't have an opportunity really to make a lot of changes to your budget this year. So sometimes there aren't opportunities, and we've been successful in getting some things into budget trailer bill language because that budget's always passed in late June. So there may be, if your agency is willing to push and you've got some really creative ideas and opportunities still to get something into a budget trailer bill to be able to help you along, especially if you have surplus funds, maybe in one of your special funds or something, and you just need that increased appropriation authority to cover it. But take a look at your program. Really look at where your expenditures are occurring. Do you have state vehicles, that you're leasing that are not being used, that are just sitting alongside or sitting in the parking garage? That could certainly be a couple $100s a month. It adds up. You have unused cell phones, other unused equipments that you're paying monthly fees for. Take a look at whether or not you really need to continue doing that or whether you can free up some funding there. Do you have office space? Do you have an opportunity to give up some of that space because other programs want it? Certainly in larger buildings, that's the case sometimes. Other programs are looking to additional space. Sometimes even just giving up 2 offices or a couple of cubicles or 1 row of cubicles can save you money on your leases. and give you enough money to be able to then shift that to be able to help cover some of your costs. Some programs have even looked in tough budgetary times at going to that 4-day, 10-hour work week. So they can actually close the offices down 1 day a week, save on the energy for lighting and air conditioning and things like that. That's not going to work well for a big headquarters building where you've got other programs. But if you are in a small office, that's a lease space out by yourself, that may be something that you can look at doing to lower your energy use bill for that and help you save a little bit of money. Do you have other resources like duplicative resources? Are you buying laptops and desktop computers for folks? Maybe it's time that you start looking at just buying the laptops and letting the field staff bring them back and forth to the office. And that saves you from having to then go and spend, $1,500 to $2,000 on desktop computers every 3 years, to replace them. Do you have unnecessary software licenses or unnecessary materials or subscriptions that you're buying on an annual basis? It may not seem like a lot, but some of these are $4,000, $5,000, $10,000. That adds up. If you find a few of these things that you can do, that's certainly going to give you some additional funding potentially to help you offset the losses towards those position authorities that are covered under your cooperative agreement. Take a look at your programs. How many of us are doing work, and the work isn't mandated in statute, right? It's programs that we've worked for many years. Maybe they're low risk food safety programs. I know we certainly had some in my old agency. They were not big priorities. We didn't see foodborne illness outbreaks associated with them. It was more driven by, the industry's desire, to have somebody overseeing what they were doing for fair competition, and you can still potentially do that, but maybe you don't spend as much money in those areas because the risk just isn't there, and it's not a statutory mandate. Do you have the opportunity, as was previously mentioned, to shift some of those costs to special funds or general funds? Do you have license fees that are coming in and being deposited into a special fund? Do you have the opportunity to maybe split fund one of those people? You can think about your coordinators are doing core activities in support of your program. I know for myself, I could have really argued very easily to support the MIFRPS coordinator with any of our special fund monies that we're bringing in for licensing, because they're providing that quality control mechanism over the work that we're doing. So if you have that opportunity, sometimes you don't even need to go to your budget folks to deal with that. You just go to your accounting folks and just change the coding. So we're going to change it, and 10% of their salary is now going to be paid for by this special fund with license fees, and then the remaining 90% is going to be paid for under the cooperative agreement. So you can look at that and talk with your folks to see if that's an option for you. We always think about things before people, right? We start cutting the things and activities like travel and whatnot before you cut staff. And that's, I think, a tried and true adage. The only thing I'm going to offer for you is that think big picture and think a little bit longer term. If this winds up dragging out a couple of years and you don't get next funding the following year, if you cut your travel down to nothing, are you going to be able to effectively do your job in the next fiscal year if you have no travel funds left? Yes, you saved the body, but now you've tripled yourself in terms of your ability to actually meet your mandate and get out and do that inspection work and the field work. So you do have to balance that in terms of that, because that could certainly wind up costing you in the long run in terms of your ability to get your job done. Next slide, please. We need to be innovative, right? We need to think about new ways of doing things and new strategies. Can we use technology to our advantage? Can we streamline our operations in some way? It's tough when people have been in the job for 20, 30 years, but this is the way we've always done it, and as managers, I've heard that many times. People are uncomfortable with change. But if there's a better way to do it, and there's a way that you can save some funding, that's an opportunity for you to actually potentially, make some funds available that, again, can help cover that difference or that gap. Do you have an opportunity to raise your license fees to help cover? I mean, you can argue that your MIFRPS and RRT coordinators, in many cases, are providing that core functionality for your program and that core support for your program, and that they're just as important as the actual boots on the ground or the supervisor of the inspectors that are out doing those inspections of those licensed facilities. So again, do you have that opportunity? Do you have a surplus in your special fund from license fees, and you just need to go to the legislature and get that increased appropriation to be able to spend it? We took a line item veto in California that was allowed. The governor actually wiped out about 10 positions and almost $1 million with the stroke of a pen that was passed in the budget. But as he's signing the budget, he lined that out. It was general fund money. And so that sent us scrambling as we come in, the first thing the next morning. Well, that special fund for that same program where we put license fees had a very large surplus. And so we were actually able to go upstairs, get management approval within a couple of hours to pitch the idea of actually just shifting those position authorities over to the special fund and using budget trailer bill language to actually increase that appropriation. It was a win-win because the work kept getting done. We were spending down a surplus that was in there, didn't have to raise license fees on anybody. And the governor's office, jumped at it. They said, yes, great idea. They were willing to put it in budget trailer bill language. Nobody lost their job, and we were able to keep it and just shift that funding from that general fund to the special fund. So again, not everyone has that, but again, those are the creative things that you need to think about and see if you have opportunities to do things like that. We talked about splitting position funding. I've heard some agencies are thinking about tapping their overall agency's emergency response group and seeing if they can help cover the cost of their RRT coordinator. And that might mean that they have to do some broader duties for the department and the department's emergency response, maybe with high path avian influenza or other disasters or things that come up. But if that means that you can keep your RRT coordinator even on as half-time in your program and have their costs covered at a higher level in the department doing broader scope work, it's still a win for you. You're keeping the position and you're keeping that workload and you're keeping that person employed. Take a look at that organizational chart. Always look for those opportunities. Do you have an opportunity to consolidate, maybe reclassify a position, maybe do away with a position that's not as important as some of the other work that's being done that you want to try and save? And I'm going to tell you to scrutinize your charges. And you may have to get a little bit of help to pull these reports out. I can tell you from personal experience, I have found hundreds of thousands of dollars being charged incorrectly to my funds. Everything from large purchase orders, $50,000 piece of equipment. It's a simple coding error. They typed the number wrong when they typed it into the system as to what it was going to be paid for, or someone put it on their purchase order wrong. So another division was charging my program. I've caught staff salaries and benefits being charged to my program from other programs. I've caught purchase orders. I've caught service orders, and ongoing contracts. It's a simple coding error. But if nobody takes the time to actually review those expenditure reports on your funds, you may be paying for other programs, staff, and equipment and supplies. So here's an opportunity for you to potentially free up some money by just spending the time pulling those reports and looking over the last 6 months to a year to see if there's stuff there that's being charged on a regular basis incorrectly because of a miscoding issue. And like I said, I found that to be very successful, and I found quite a bit of money, doing that. So hopefully that's not happening to you, but it's worth a look to do it because most programs never go back and look at their expenditure reports. All they do is look at how much money is left, how much is spent, how much is left, and they move on. But looking at the actual reports can give you a lot of great opportunities. So I'm going to pass it back over to Katherine to talk about some of the things you need to think about in terms of consequences for cuts that are coming.
Great, we can go to the next slide. All right, so in terms of consequences, we're going to go through a number of things to consider, but the idea is the importance for you is to recognize the role that you play and the control that you do have in that understanding the consequences. It shouldn't be an exercise in sort of fear mongering for yourself or being able to move back into that reactionary space, but it really is about being deliberate and understanding from the evaluated choices that Pat had just gone through and what options you have in front of you, being methodical and understanding what those potential consequences are so that you are making an informed decision and that you are avoiding unintended consequences. This also is a really good way to get you in a position where you can more clearly and directly articulate the consequences to external parties so that you can have more tools in better communication styles in order to get better advocacy so that if the external partners you have, whether it's within your administration of your agency or whether it's with your stakeholders or whether it's your legislature or other options, other partners, you can be more direct about it and potentially get added resources for you. So the investment in understanding to a level of specificity for clear, direct communication, what these consequences are, is both good for you as a decision maker, but it's also good for you as a communicator. So in terms of that, you really need to take those investments that you may have already made in terms of metrics for your programs or program outcomes, use those understandings that you have of the current investment levels. What is that getting both your consumers, your industry, partner agencies, potentially extension or other public health agencies? What are they getting out of the previous funding level? And so what does that mean they will be losing with the changes that you're exploring? So with that, we also want to make sure we're understanding what this means in terms of public health and food safety work in general, as well as that overall capacity that you have for emergency response work. An example that we have in Minnesota is that our rapid response team, we are a core driver for the skill development within our agency for ICS structures training, but then additionally for the competencies of our inspection staff to be able to support our agency in broader emergency response work. So if we no longer have some of that base funding to be able to provide that training, that will have an adverse impact both to the agency as overall for how it is that they function, but also for the much broader animal health or other emergency response activities that our Department of Agriculture conducts. So understanding how it is that you can knit those pieces together. You also want to be able to understand what the potential public reaction and perception about the program changes may be. So depending on what specifically is falling within your wheelhouse, you may have more direct services that if they're adversely impacted on the customer service side, will be an adverse consequence overall for your agency or for the broader state government or local government that you're working in. So understanding how it is that your program has that customer service interface and understanding what is most valuable and important to them, and having an understanding of how will the choices that you make in terms of making cuts or redirecting staffing times or cutting potential added software or other services that you may currently use, how will that impact your customers, and how loud of a voice will that customer have, and what will the impact of a dissatisfied customer have overall. And so being able to understand what that is, because again, part of this conversation is being very thoughtful and understanding, is that a consequence that we're willing to bear? So part of it goes to, is this a decision I want to be able to make? How am I prioritizing where the funding needs to stay? But also, how can you very tactically understand and use that in conversations about impacts to potentially get added leverage or added resources to maintain some of those services? We also want to make sure that you're looking at long-term consequences. So something to think about, again, what is the short-term cuts that we have? How does that right now, is that going to have a bend or a swell in your overall processes? So thinking about how it is that you train staff coming in. So if we cut trainers or we cut folks who are in that supply line, and as a long-term result of this, we end up having we're losing staff overall, we've now impeded our ability to have adaptability in the long term. So thinking about where we're making some of those cuts, is it sustainable in the long term? Are they short term or are they long term in their effect? But also, again, is this preventing our program from being where it needs to be for other things that we know are on the horizon? Also understanding your ability to meet the deliverables for your federal contracts. So these may be grant operated fundings, but looking at other contracts that relate to the capacity that you have, or more directly just to the execution of current contracts that you have in place. So being very direct about what that'll be and being able to prioritize or be very clear what services you'll no longer be able to provide in relation to those contracts is going to be important. And again, being able to explain the direct line between what you may be cutting and how that cut will have that impact on that federal contracting. Is it strictly available time? Is it no longer prioritizing that inventory? Is it added duplication and work that is no longer able to be bared by the program? Any of those would be an example. If you just plain old don't have the capacity to be able to complete that number of inspections anymore, those can all be examples of what may be done. Again, we talked a little bit about training and development of SMEs. And so we're, again, thinking about long-term, we want to consider how it is that our pipeline of expertise develops over time. So again, thinking about your regulatory system, where do your compliance officers come from? Where do your high-level technical experts to be able to do more complex work? Where are those coming from? How it is that you are developing the expertise in those, what it is that you have to be able to do in terms of internal training and development to achieve that level of competency. And that if you lose that in the long-term consequences, the short-term individual people who are here now, but if you also learn that retention and replacement capability in the future, what's the impact that's going to have on your ability to perform any technical work in the future as well? You also want to understand how this may, any cuts may relate to other funding sources that you have. So really understanding how, as a regulatory program, you have a network of services and ways that you may fund, and looking at your initial relationship with the industry that we're regulating, all the way through how we complete and maintain those relationships over time. So think about tip to tail, how do we do inquiries for businesses that want to open? How do we educate and inform and provide services for those businesses so that they can understand what they need in order to meet the regulations, and how to set that up in a way that is safe, so that when they apply for a license, they have what they need, that we can promptly and efficiently process and administer getting those licenses issued, how it is that we get inspectors out in the field to do verification activities. But then what happens when something goes wrong? Are we able to deal with incidents? How are we dealing with enforcement cases? How does that feed through the system? And again, ensuring that we have that the response to that. So looking at where other programs, whether it's in your laboratory, or whether it's in shared services, in terms of educational programs or anything else, how they fit together in providing services for the industry as a whole. I mean, being able to articulate how changes that you are making, or understanding how changes you will make, are going to impact that web in the long run. Next slide. In addition to consequences of the more sort of metric-based or sort of numerical service transfer, really start thinking about how this is impacting, again, that long-term quality of the program, and the staff and the environment that we're providing. So there's a number of things that we know that we can bear in the short term, that we can step up, but they're just not long-term like a sustainable option. This again is back to having those realistic conversation about what is a reasonable ask of our staff, what is a reasonable ask of the program, and being able to make hard choices about the things that we'll no longer be able to do in order to continue to do the things that we are doing. So inspection loads need to be considered. You can't just say go out and be faster. Sometimes what you need to say is these are the things we're no longer going to be able to do in order to maintain the quality staff that you have, but also making sure that we're able to adequately compensate them and understand the technical capacity of what we're asking them to do, and ensuring that their positions are classified to be able to do that. Again, this will have potentially a long-term impact on your ability to bring in new staff and then keep them. So really getting real about what is the level of turnover in staff that we can maintain. Our current training models and our current ability to do work is probably going to be impacted, and figuring out if we can continue to train and maintain staff the way that we have in the past. You're going to have to be real about that. And so thinking about how does our inspection design correlate to the staff and how we train and bring them on. And you're going to have some very real conversations about how you break up the work, and you may need to consider doing things differently based on that. So again, looking at the options, but also evaluating what are those consequences in terms of doing that. Conformance with the standards, the ability to get people trained faster typically means that they can do fewer things, or they can deal with less complex things. Do you have a model that can sustain that over time? And those are some very significant conversations. You're going to have to include HR and things like that. So thinking about, again, these short-term budgetary decisions may have these broader consequences for you. Again, how do we find a way to get to that increase in impact in those foodborne illness outbreaks, and how it is that we can more effectively shorten those periods from identifying and then intervening and getting contaminated or adversely impacted product out of the market. Being able to figure out how this impacts your epidemiology units, your response units, that trace back is going to be really important. Again, this is highly technical work. We need to find ways that we can do this effectively, but also maintain that speed of the capacity, the speed and how it is that we get out and we take these interventions. Overall quality control program impacts are going to be important too. Again, this is part of the integrity and the quality of the governmental services that we offer. The better that we can maintain our services, the better that we can share those stories, the better that we can maintain that relationship with our industry. And so understanding that just cutting quality for numbers doesn't necessarily save the day. It can have those long-term consequences. And so understanding where it is that being able to use our quality control programs has been to our benefit in long-term funding conversations is something to consider as well. Also, again, when we have misses, when there's gaps that we can't fill, that's not necessarily something that we get to control the story on. And so understanding and be able to share where it is that you're not going to be able to control that message, and realizing that's sometimes going to be a real consequence, is having media attention on complaints or issues or situations that we did not have the capacity or capability to respond to in the way that we would have in the past, and how it is that you can manage those messages and those stories, and thinking about which ones may influence your administration or the legislature, and how to use that and get them to maybe reconsider and redirect resources to you to address those potential situations in advance. Also understanding how reduced travel is going to impact your long-term training and external engagement. That is something that, again, with the standards, both retail as well as manufactured food and animal food over time, we've really been able to see that investment in how it is that we develop relationships with our external partners. So those in the educational and academia setting, those in our industry, and also in co-industries, and being able to see that those were investments and understand how reducing those will, again, reduce those relationships. And that does, again, end up in having another adverse impact on your program in the long run. So how to be able to juggle those consequences and make sure that when you are making cuts, you have that full picture of what the potential loss is beyond just the funding, but those other adverse impacts to your program, and making sure that you are willing to bear, or that you at least understand what those impacts are, and you're making an informed and deliberate choice when you move forward with your shorter term budgetary decisions. So with that, I will pass it back over for the next slide.
Next slide. Thank you. All right. Up until now, we have been talking about how are we going to be making these cuts? What all are we going to be doing with staffing or funding? So now we want to look at making that a actual reality, and everything we have to do, and also making the actual necessary recommendations to actually put this into motion. You are going to have to prepare budget reduction documents. Make sure you identify the impacts and the consequences. You want to make note of how this is going to impact stakeholders, industry, consumers, as well as staff. And what impacts this will have on training of staff and the quality of work completed by the program. And how will this impact your ability to actually respond to to emergency events and foodborne illness outbreaks, as well as your day-to-day duties? And are you going to have to change inspection frequencies based upon the funding cuts? Are you going to have to not hold as many public meetings or having stakeholder meetings? And I want to based upon experience, try to avoid multiple rounds of cuts. It's much easier and less stress on everyone to actually go to go through this process only once. It is not only tough on you as a manager or but it is also tough on staff not knowing if more cuts are coming down the road. Next slide, please. And a way to actually get this information into the proper hands is to actually create a one-page information sheet. This sheet can provide key information about the impacts of the budget cuts. This can be shared with staff, upper management, decision makers, and stakeholders. Discuss the real impacts on quality of work, the ability to train staff, and to actually respond to emergencies and foodborne illness outbreaks. You want to make this one pager simple and eye-catching. A actual legislator or a secretary will not take time and read paragraphs long information. Go ahead and make this easy to read and also easy to understand. So I'm going to turn this back over to Pat and go on to the next slide, please.
Steve. All right, so specifically when it comes to your cooperative agreements, there's a couple of things that we do want to share with you. Based on information that we're hearing from FDA and some of the things that we're seeing going on, you need to anticipate that your award for this coming year that you're going to be getting for the next year is going to be late, Okay, meaning you're not likely going to have it before your current year's award ends. So with that being said, you need to really think about being conservative with your current spending, so that you can request continuation of that spending opportunity, the ability to carry that forward and continue spending during that gap time between when this year's cooperative agreement ends and the next one actually begins. Especially with the staffing issues that are going to be probably coming into play because of loss of probationary employees and potential layoffs coming down the road. While all very unfortunate, the reality for you is that you're likely not going to see your notice of award anytime in the near future, right after your close. So plan on being able to survive for a few months. Hopefully you'll be able to be a little bit more conservative for the remainder of your year on your current grant cooperative agreement funds, so that you'll have something to hopefully help you during that gap time period. We need to ask that tough question. And I know that the states are having their meetings with FDA now, and a lot of states we've heard are really thinking about, should we even continue the agreement? If we can't even support, a person, is there value in continuing this? So you have to really look at whether or not that revised number is going to be adequate to meet your needs and the agreements that are, that are required in your notice of award. If FDA is willing to make modifications to that and drop the requirements so that you can do it with the lesser amount of resources that you might have available, then that's one thing. If they're going to expect that you have to do everything there with less, the reality is you can only do what you can with the resource that you have. So you have to look too, what are the reporting requirements? There's a lot of extra work there that may need to be done. So you might need to talk to them about cutting back on some of the reporting requirements. Mid-year reports are optional, but FDA has put them into the notice of award. The year-end reports are required. Everyone's going to have to do them, but what goes into them is still, up to FDA and somewhat negotiable. So you have that opportunity to have those discussions with them during your one-on-one calls with them. Thinking about strategies for your actual cooperative agreement funds. Again, reducing or sharing employees with other programs. So instead of a full FTE, maybe you've got 3/4 of an FTE that's paid out of the cooperative agreement, and then 1/4 of their time is being handled or paid for by something else. You're probably going to need to look at reducing your travel line items. We're not going to be having in-person meetings in the next couple of years for MFRPA or RRT. In-person trainings are probably going to be going by the wayside as well for the next couple of years, as OTED is moving most of their trainings to virtual. So keep in mind, you may not need all that travel money that's there. That may give you some additional funds to be able to support actual salaries and benefits. If you're out collecting samples, you're buying a lot of supplies for collecting those samples, maybe you got to reduce the number of samples so that you don't have to spend so much money buying all the supplies for the sampling equipment or pay for laboratory reagents or anything else that you might be paying for under that cooperative agreement. You might also just need to reduce the number of people that you're sending to specialized training. It becomes a lot less costly to you if those trainings go virtual, because then you don't have to pay for people's travel. And that's kind of the direction we're hearing that's going to be going for the next year at least, is that most of the trainings are going to go to a virtual format to reduce costs, simply because FDA doesn't have money to send the instructors there to teach the class either. They're on travel freezes right now, and their funds are getting squished as well. So I think that may help you a little bit, but maybe you have an opportunity to just have a little bit more specialization. And not have as many people cross-trained in all the specialized advanced training areas. That may help you if you are having to send folks to go to training. With that being said, I want to go ahead and we're going to open it up to you. Amy, if you go on to the next slide. We'd like to hear some of your ideas. We know from talking with a lot of the states that they're coming up with some creative ideas, and they also have some additional unique challenges. So this is your opportunity to be able to share that with the group and provide that feedback and input. So if you are interested, if you go down to your more button, you can, I believe, raise your hand, or Amy will give you some instructions on how to do that, or did I see the raise hands right in the middle? Moving around in the wrong place. So yeah, if you use the raise hand down in the footer, you should be able to raise your hand. Amy will recognize you, and then we can unmute you so that you can ask your question or make your comment. So if you'd like to add anything, if you've got any unique ideas, please go ahead and use that reaction down there to raise your hand, and we'll open up the mic for you.
You can also use the actual chat or the Q&A button there on your screen if you wanted to actually ask a question as well.
right, I see Carla has her hand up. Amy, if we could unmute Carla.
Hey Carla, I'm gonna go ahead and allow you to talk. You're going to have to unmute yourself and then you should be able to chat.
Okay, can y'all hear me?
We can. Hi, Carla.
Awesome. I figured nobody was talking, so we might as well engage.
Hmm.
And so I'm sure everybody is in the same boat where we have all been cut a great deal in our RRTs and our MIFRPS programs, but most of the contracts and flexible funding for the laboratories have not. However, we are looking at, but they want us to support those programs, and bless their hearts, they don't seem to understand that this is all interrelated. So I know that we recently got asked for our letter of support for the laboratory, and they want some very definitive statements about you will continue to do all of this stuff through your RRT that is now cut by 60%. And I'm working on drafting language that says we acknowledge that this is important. However, with the lack of funding, these activities will either be delayed or we will only be conducting Michigan activities and the rest will be turned over to FDA for work. And we really are pushing back on all of those things in writing, and we're doing it in every meeting. And I know that we are, apologize, my other phones are going off, and being very consistent through each of our grants, from our laboratory grant to our RRT, our produce, all of those, that these are the things we cannot perform. We may still perform a lot of that work internally, but FDA doesn't get that work. And we are also, I'm sure everybody else is in the mutual reliance discussions with FDA, and we are really drawing back on that because they're asking for a lot of give with, with no funding behind that. And we've recently canceled our meetings for that with FDA as we negotiate this very difficult process. I do think that as we go forward, speaking with that unified voice from all the states saying, we're not going to be doing these mid-year reports, we're not going to be doing these projects on your behalf, is really important that we do that as a unified front from the states across the board, that we appreciate that they want all of this information and that they want us to do these activities. However, when you cut one program, you cut all of the programs because these are not independent. And so speaking with that one voice from all the states, not just through us and not just through AFDO, but through the leaders of our agencies and through our legislators, is really important.
Yeah, those are all good points, Carla. And yes, the current word on the street is that contracts are not going to be impacted, but FDA is currently going through budget reduction drills, which I think Aaron just mentioned in chat, and that's going to potentially go into effect next fiscal year for FDA. I believe it's been extended beyond the original March 15th date. So they're going to have a little bit more time to put their drills forward and for FDA and HHS to make decisions about, internal budget reductions and potential reorganization again, to save costs and streamline operations. But yeah, I think the lab flexible funding model, while most of the money is going there, there is seemingly a lack of recognition as to just how much work for programs to go out and go and collect the samples, because in many cases the labs don't have the authority to go out and collect samples or go out and do that, so the programs are doing that work. And then of course, if there's a positive sample finding, that creates a lot of work for the state program, to go out and actually deal with that, work with the company to do a recall if it's a firm that's based in that state. And that's a lot of work that, all of a sudden now we don't have necessarily funding for. So we're having to stop doing something else to then go do that work. One of the things you may think about with your labs is requiring them to actually pay for that. So maybe they need to be paying for a portion of your position out of their lab flexible funding model now, since your program has gotten cut, so that you can do sampling, you can do a certain number of follow-ups on positive samples, and then that you can actually charge against that. And that may help you actually cover some of that loss of funding for maybe your RRT positions. So that's something you can think about in discussions with them, because they have that opportunity to build it into their budget. Keep in mind, this is a new year for Lab Flexible Funding Model, and keep in mind what I said earlier, all cooperative agreements are going to be late. So they are likely not going to see it right away, to be able to continue on as theirs ends. The new one, it's a new one this year. The awards are not going to be probably right on time, so there's going to be a big gap there. We know lab funding has been cut, but I don't believe it has been cut to the degree that all the other programs are not taking 60% reductions like our RTs are.
No, they're not.
Yeah. So thank you, Carla. Steve, Catherine, any other comments on what Carla put out there?
Yeah, I was going to bring up the actual same point about like having those outside of the box talks about the shared funding. Even if it's a little bit, it would help fund a spot or a like FTE that is on the verge of like being cut. And the lab will like have to listen, because if the program is not able to actually like those samples, the lab will be in jeopardy of like not working in their full aspect of their funding.
I would just build on that, and also just remind everybody that, depending on what your relationship with the lab is, it could be something within your agency, it could be a partner agency that you're working with, but to really lean into that as an opportunity for collaboration, but also for analyzing impacts, right? So view them as a partner, not as a competing factor, so that you can really find what are reasonable options and what's the best way, as was shared before, about how to be consistent in the communication about impacts. An example of this would be, again, how can you look at your two sets of resources, even though they're both cut? How do you look at it as a pooled set of resources, but analyze the work as the complete system, right? Collecting that sample, analyzing the sample, and then the response to that sample, but also considering what is the benefit that your regulatory program is getting from having that LFFM program functioning, right? So an example is this funding that is going to your program to pay for your staff to maintain the competencies in sample collection. So depending on the maturity of your program, if you don't have your own directed sample, surveillance sampling type program, that's an opportunity that is now getting paid for, potentially, if you have that conversation with the lab, that you can get some of those quality systems, keep them in your program, maintain that competency and that demonstration of your staff to be able to do that work and do it efficiently, but to do it in partnership with the lab. So thinking both in terms of not just the funding, but what are other benefits that you're getting, and getting the most out of the funding that is available and using it the most effectively.
I'd seen Corinne's hand go up, but then went down. Corinne, did you still have a comment you'd like to make? If you can, just raise your hand again, and Amy can unmute you.
Hi, Karine. I will go ahead and allow you to talk. Just like I said, you will have to unmute yourself, and then you should be able to chat.
Hi, can you all hear me?
We can.
Hi. So first, I just want to say thank you for putting this on. This is very helpful, and I wanted to thank Carla for speaking up. Our conversations kind of took a similar pathway. We didn't find that they were likely to budge. They were very stern on their position. And so we also wanted to make it very clear, like, hey, we can give you the short list here very quickly about, where you'll see the most significant changes, but have no doubt that this will bleed into every other program and throughout all of the standards. So there will be changes. However, we weren't able to say exactly what that would look like at that point with so many things up in the air. Another thing that they were pretty firm on was that there would be absolutely no rollover. And so with the gap and things like that, and me being a new manager and kind of new to navigating these, can you guys provide any clarity on what that might look like? Helping me better understand, as well as any strategies that you all or the group might have for having those conversations.
Yeah, so I think, when they were initially saying no rollover, or carry forward, there was, the thought that there was not going to be, an allowance for that or enough funds to, to allow that. You didn't want people like stopping all the stuff they're doing now to have full funding next year. But I think with the realization that the new awards for next year, the new notice of awards, are going to be significantly delayed. I can tell you for AFDO and one of our cooperative agreements, when we changed over from the end of one award to the beginning of a new award a year ago, we did have permission to use carry forward to cover the gap time period. And I think that's, what we're hearing is, hey, states might want to be conservative with their spending for the remainder of the year. So I think there is an acknowledgement that they're certainly at least going to need to be able to provide you with some of the carry forward to cover any gap between the time that your current budget year ends and your new budget year begins. So I would say, continue to plan that you may have some carry forward to at least help you with that portion of it. Whether or not they allow, some or all. Again, I think if you are in the position where you need $5,000, $8,000, $9,000 to fully cover a position with the reduced amount, they may be willing to let you carry forward some of that money to be able to cover those costs. And when we say carry forward, the likely is that you will carry forward the money, but it will be an offset, right? And so they're going to still cap the overall total dollar amount. The big wild card is they're going through more budget drills now within the agency, so we don't know where any of this is going to wind up. They don't know where any of this is going to wind up. So there's a whole plethora of different options that are being put forward, and upper management will be making those decisions in the coming months. So unfortunately, we just don't know exactly where it's going to be. And I wish we had the crystal ball. I know for myself doing this budget work and those types of things over the years, it's nice to have a better idea of what's happening to make better decisions. But all we can do is just kind of play the odds ratios and look at what we think is going to happen and then respond appropriately with that.
Yeah, I would encourage you to actually be upfront, be honest, go ahead and like have it and like have a game plan when like talking to the FDA, and go ahead and have your bullet points, your ready, and the things that like you need first and foremost. I wouldn't give them a long laundry list. I would focus on key points.
Yep. And Kim, oh, go ahead, Katherine.
Oh, I'll say and I would just build off that to say, and also just remember that like being clear in your priorities and being realistic in what can and cannot be done. It's a difficult conversation, but it doesn't need to be an adversarial conversation. And that is the part to just realize that, the budget cuts we may be specifically speaking to is this current version for FY26 of FDA grants. But these are all principles for sort of broader issues that we're dealing with, and recognize that the folks in FDA that we're dealing with, a lot of times they're not necessarily the final decision makers on a lot of what they're being tasked with implementing. And so just recognize the more realistic and the more direct we can be, but then the better we can figure out what the next steps are in terms of how to get that implemented. But that doesn't need to be done in a manner that is necessarily adversarial. So.
And then Kim asked about if we thought that the Lab Flexible Funding Board grant was also going to be significantly delayed. My crystal ball, while a little bit fuzzy, and from what I'm hearing from within FDA, is that OAGS is going to be very backed up on getting these awards out. And so, yeah, my guess is it's going to be delayed. So you need to probably plan on having a few months that are not going to be funded unless you have that ability to use any unspent funds that you can carry forward a little bit to cover that gap. And I know FDA is trying to draw a hard line right now on no carryover funding, but we have had some conversations and people have asked some questions, and it's not, completely set in stone. So I think there may be some flexibility with a little bit of this, depending on scenarios as we get a little closer and they get better answers and more information. So hopefully we'll be able to keep you guys informed as that develops and be able to share that information. Mark also made a good point for those of you that do your coding and your billing against your cooperative agreements kind of as work is completed. They're actually setting it up to actually code it so that, it's more position based and activity based and just goes towards and hits it all the time so that they'll be able to spend all their money down and not have to account for every 15-minute block of time or half-hour block of time that they're doing. And of course, we know when we do that, we miss charges, right? Because we just do a little bit here, then we jump to something else, and so we don't put all the billing against it. So, if you have a way to set that up in your accounting system so that everybody's time for that particular group is being charged to that, it makes it a little bit easier to make sure you're spending that money down. Any other comments? Anyone else want to chat or share anything? They can raise their hand, use that reaction button there in the footer of your screen, raise the hand, and then Amy can unmute you and let you share. Got a few more minutes. Okay, well, I'm not seeing any more hand raises. So with that, then I guess we can go ahead and start wrapping things up. Amy, if you can go to the next slide. So just a couple things and we're closing. Use your relationships, make sure you engage your stakeholders, get them working for you, with your budget folks and your legislative folks to talk about how important your program is and why they want to see you continue on. That carries a lot of weight when you have your industry associations and your companies coming forward and saying that they value your program, that you're a very important part of their success. That really does make a difference when you're going forward and asking for any modifications to your budgets. Know your audience, know who you're talking to, make sure that you share the information appropriately with those appropriate levels. Be creative, right? Pitch ideas to management. It's okay to think outside the box. Talking with your management team should be a safe space where you can explore different ideas, explore different ways of doing things. And just because we've not done something before doesn't mean that we can't do it that way again. As I mentioned earlier, when we had that line item veto, we had never, done that before, but we scrambled, and within the course of 60 minutes, we had presentations going on up in our center office and going up to the director's office and on over to the governor's office within a couple of hours. So it was fast moving and we made it happen. We just got creative. The management team sat in a room and pitched ideas around and came up with some, and we thought this was the best one, and we got everyone to buy in. It was a win-win for everybody. So, go for it, have those discussions. Don't be shy about, throwing different ideas up to your management team to be creative in how you might be able to, continue to resolve this. And, in all your discussions with FDA, I know they want you to do everything. The reality is you can only do what you have funding to do. And if they've cut your funding by 60%, they can't expect 100% of the work. They can expect 40% of the work that you did previously, unless they're going to streamline it in some way, right? Then they might be able to get a little bit more. But reality is we can only do what we have staffing to do. If you have to split fund your staff and part of them are going to be funded to do other activities, their time's not going to be available then to go and spend to do all that work that FDA wants done on that particular cooperative agreement. And yes, the mutual reliance agreements, the partnership agreements was brought up. I know I've heard from a number of states that they are having to go back and say, yeah, we're just not going to be able to do some of this work. The reality is with the reductions and the cuts, you can only do with what you got the resources to do. And once those resources are cut, then you have to make reductions in all of your work elsewhere. And when you have statutory mandates, the statutory mandates have to come before that extra nice to do work that we'd all like to participate in. We'd all love to share. We'd all love to work together. But we do have to do what our funding allows us to do. With that, go ahead and go to our last slide, Amy. I'm going to turn it back over to Jason to wrap things up for us.
Thank you, Pat. And thanks, Katherine and Steve, for your presentations. And thank you, Corinne and Carla, for joining our conversation. And everyone in the chat, thanks for letting us know what you all are dealing with. Excuse me. As a reminder, we have 3 more sessions in this webinar series, and the registration links are in the chat. Just a reminder again, that's tomorrow, March 6th, is Leading Through Change, Strategies for Navigating Uncertainty in Public Service. And then next week, Holding Steady, How to Lean into Resilience is March 12th at noon Eastern. And Doing More with Less, How to Streamline Your Operation When Funding is Cut, is March 13th at noon Eastern. You can also go to afdo.org/events to find out more. Thank you so much for joining us, everyone, today, and have a great day.